Assalamu alaikum, hi everyone. My name is Ahmed Shukri, and today I will present to you the MRI specific absorption rate. So here in the agenda, we will begin with introduction and then explain the specific absorption rate for the MRI and conclusion. So in the introduction, so the magnetic resonance imaging (MRI) is a medical imaging technique used radiology to create images for the anatomy and physiological process of the body. MRIs can use strong magnetic field gradient, and radio waves to generate images to internal organs. So the MRI is distinct from CT and PET scans because it does not involve the use of X-rays or ionizing radiation. MRI is a medical nuclear magnetic resonance applications, and can also be used for imaging in other MRI applications such as spectroscopy. So the MRI is widely used in hospital and clinical for medical diagnosis, staging, and follow-up care of disease. Compared to CT, and MRI provides better contrast in soft tissues images in the brain and stomach. However, patients may feel uncomfortable because the subject's measurements along the tube are mostly long and large. In addition, implants and other non-removable metals in the body pose a risk and may exclude some patients from safe MRI scans. So the SAR stands for a specific absorption rate. The SAR in MRI is a amount of power or energy absorbed in a human body by the radio frequency RF field in the certain mass of tissue. The unit of SAR is given by watt per kilogram. So here we have the equation for calculating the SAR. The first one, the electrical conductivity of tissue. So the tissue conductivity fluctuates tenderfold throughout the body, maximizing in higher water content materials such as blood and urine, and minimal in tissues such as bone and fat and lungs. The second one is the body size. So the body size, two-dimensional mode, we found this RR proportional to a square, the square of the body cross-sectional area, because a equal to pi r square, where r is the radius. Moving on, the third one, the RF frequency. So the RF frequency is usually chosen to exactly match the Larmor frequency. The Larmor frequency is directly proportional to the electrostatic field strength, V0. And the fourth one, flip angle. So this is due to the fact that alpha is proportional to the average amplitude of the RF pulse, V1. The duty cycle represents the percentage of time in pulse sequence in which radio frequency is transmitted. So there are several considerations to be considered for increasing the body temperature of the patient, such as the cardiovascular disease, hypertension, diabetes, increased age, obesity, fever, impaired ability to respire, pregnancy, implanted devices. So at the conclusion, MRI, one of the most important devices, uses an electromagnetic field to image human body organs. One of the considerations that should be taken is the SAR for avoiding increasing patient body temperature. There is a calculation explained that helps how to calculate the SAR.